Okay. Hi, everybody. So, today we'll talk about intermittent claudication. So, we have a patient. Uh, the patient is 60 years old and smoking one pack of cigarette a day, which is a big risk factor for intermittent claudication. Please note that intermittent claudication is caused by a disease that we call the peripheral arterial disease, a condition that is um, very prominent as a vascular disease caused by atherosclerosis. So, our patient recently he felt pain in the ankle, which forced him to stop after 50 meters walk. The pain became quiet during standing, and after a while he continued walking again for about 50 meters. He complained that in the night time he had pain in the right ankle and the toes, and this awakened him several times. However, the pain did not become quiet when the patient sat on the bed and took the legs down. During medical examination, the doctor found that there was no pulse location in the tibialis posterior and the dorsalis pedis of the left leg. Now, in the right leg, it was impossible to feel the pulse location. The arterial systolic pressure in the brachial artery was around 160, and the tibialis posterior of the left leg was around 90 millimeters of mercury, and the tibialis was around 60 millimeters of mercury. Blood tests revealed high cholesterol levels. Now, in this case, we'll change. So in this case, we have to isolate some of the symptoms that are going to qualify our diagnosis. So far, we have concluded that our diagnosis is intermittent claudication caused by PAD, which is peripheral arterial disease, and one of the signs and symptoms of this condition is pain in muscles, and the pain is usually brought about by exercise, in this case walking, and it is relieved by rest, in this case while he was standing, and there is no pain at the start of the exercise. However, there is a constant distance before which the pain comes, and in this case, after 50 meters, our patient would experience the symptoms. And in this case, this is called actually the claudication distance. The pain-free distance is what we call the claudication distance, and it may become short if we walk faster, or longer if we walk slower or walk slower. So we have to go over the pathomechanism of the disease and try to understand how does this disease happen. Now, this disease happens as a result of insufficient supply of blood, which has oxygen, to the lower extremities, and in this case the legs. In this case, the legs will become ischemic, and definitely they will start to pain as a result of cell death and accumulation of lactic acid. Now, intermittent claudication is a circulatory problem where part of the body does not have enough blood. That lack of blood flow is known as ischemia, means that the affected area of the body does not have enough oxygen. If ischemia lasts for too long, there can be damage of the affected area and even cause the affected cells to die. So, another thing you need to remember that because of limited supply of oxygen, the cells are going to undergo anaerobic respiration, and this is going to lead to increase of lactic acid, which will definitely lead to pain. Now, the medical diagnosis, how can we diagnose this disease? One, we have physical examination, and the key signs here we are looking for is that if the pulse in your legs or feet feel weaker, and it's possible to feel the sound sometimes, or to hear it, or to feel the pulse, this is a clear indication of limited supply of blood to the lower extremities. Now, the ankle and the ankle branchial index. Now, this test measures and compares the blood pressure in your ankle and arm. If the ankle pressure reading is low than the arm reading by a wide enough margin, that may mean that there is claudication in one of the legs. So in our case, we can observe this clearly because the arteriosystolic pressure in the brachio is around 160, and while that of the arteries of the leg is around 60 and 90, which is a quite big margin. This clearly indicates that there is limited blood reaching the legs. Another procedure you may perform is the arteriogram, and in this case you inject liquid that is contracted and injected into the arteries in the area. Where there is possible, intermittent is possible. That contrast is bright enough and is visible in an X-ray, and can show the health workers the saturation in that area. Now, how can we treat these symptoms? One, we have to give blood thinners medication that prevents thrombosis and embolism. We can give statins to prevent or lower the cholesterol levels. In our future videos, we shall describe the action of a statin, blood pressure medication, in general cause. We can give blood pressure medication, and this generally cause vasodilation and cause, in turn, better saturation. We give diabetes controlling medication. This prevents further heart problems because diabetes has a strong connection with blood pressure and cholesterol levels. So it's quite important to control the symptoms in this way. Surgical methods, with a few surgical mechanisms that can be employed, and this is the cutaneous transmural angioscopy and bypass surgery and arthrotomy. With this, check out our video about statins and atherosclerotic development. Thank you.